to start the communication as professional first with parents, because parents will always have an inhibition, a fear, or a block that what would a person who doesn't have a child with the similar that I have, a child with disability, a child with multiple disability, what this person is going to tell me, what this person is going to teach me. So it is up to us professionals to start the communication, start eyes, as they say, and talk about what you know of the child that you're working with. Because that is something which will put the parent at a very comfortable position. Remember, we don't talk to strangers. Even if we are traveling in a train or in a bus, we meet someone, we start communication when the person sitting next to us or opposite us gives a smile to us, you return with a smile, and that's how our communication starts. So please, professionals, don't go as if you know everything under the sky, but go with humility, humbleness, and start the communication. Why you are there? What do you know about the child? That's the beginning we need to have. And when, second tip I would like to give, that when you start communication, start with a compliment about their child. Don't start with, oh, your child cannot do this, he cannot sit, he cannot eat, he is not toilet trained, he can't speak, he can't write, he can't do this. Don't start the communication with that. Always start with a compliment. Talk about a good thing that you have come up with that particular child. Start with a small story. When you met first time, when I met your child for the first time, I was so impressed that she could smile at me, or she could grab an object, whatever little thing, but start with a compliment, because nobody wants to listen to, about their child inability or disability. Everyone, we all, when we go and meet parents, we go and meet family members, we want to hear from others that what our child can do, what our child is able to do or excel in. Just imagine if you come to my house and I tell you, oh, your child is mannerless, he can't, wash his hands, she can't do. What would you feel? Will our communication will be a good communication? We will not have a rapport. So same thing. Think about a positive thing to start as far as the child is concerned and the parents. And whenever a professional starts with a compliment,
good morning,
immediately with that parent on your side. They will become your biggest supporter. And the most of the difficult things you want to ask that parent to do with their child, they will be doing it. So start well, communicate, you initiate the communication, and start your communication with a compliment for the child. And other major thing which we normally do as professionals, that don't tell the parents to say, teach your child to behave. He has this behavior problem. He has that behavior problem. He bites. He throws. Remember, all of you remember, every behavior is communication. Every behavior, whatever we do, it's not related only to children with disabilities. Each one of us, Lakshminarayan Garu is shaking his head at the moment. What does it communicate? That he and I are on the same wavelength. He also feels what I'm saying is correct. That is the level of, behavior. One behavior, connects me to Lakshminarayan Garu immediately, that he and I are at the same wavelength. So every behavior to demonstrate something, and treat every behavior, every problem behavior as a communication with the child. And that is what we need to tell our parents, that whatever the child does, cries, every cry is different, friend. Every cry for attention is different than cry for food. Cry when the child is wet or he is, uncomfortable position, it is different from the cry when the child wants to go out. So every cry, every behavior is there to communicate something. And this is something which, as professionals, we need to tell parents that don't take the behavior of the child as a negative thing. Take it as a positive communication, as a way of expressive communication from the child. Because at the moment, your child is not able to communicate in the manner the world is communicating, by words, by action, by gestures. So we need to tell them, look for behavior which are there to observe and take it as an expressive communication. Another tip which is very important is we need to educate parents. Educate does not mean that you give them, material to read and, test and assignments. No. Education means you do work with the parents. Hands-on. We need to show the parents that if you have to teach communication, if you have to teach, simple skills of holding, grasping, any skill that you want to teach, you do it hands-on in front of the parents. That is how you educate. By speaking, unfortunately, at the moment in the pandemic situation, we are not able to, do face-to-face work with the parents. But we can always do through videos. Use your own children, use your co-worker as a child with disability or multiple disabilities to teach a particular skill. Do a simulation exercise. Make one of you professional become a child with disability, because you don't have at the moment a possibility of going and working with the child directly. So use these kind of opportunities to educate parents. Lecturing is not education, my friends. If that is the case, the whole world would have been educated by now. We are literate, but we are not educated. There's a lot of difference between these two things. So please educate your parents, educate them so that they can do what you are doing as professionally qualified, experts with the child. It is very important that we work with parents, not work through parents. We need to work with parents. Don't order them. That's another, observation I've made. The professionals sit or, stand like this with their folding hands, and they'll say their parent, oh, hold that hand like that. No. Bring him up. Oh, make him sit down. Do it. Don't direct. Do it. Another very important is aspect which we do as professionals. See, we are special educators. We are trained in educating the child. We are trained in how to follow an individualized education plan. Never mention about medication. We are not qualified to give medication to children with disabilities. If the child has a symptom, the medication needs to be given by the expert who knows about that symptom and the cause. And that is where we need to work with medical fraternity. We need to work with people who understand the condition the child is in. Child is getting convulsions or seizures or fits. Please do not, I repeat, please do not give any medication from your side. We are not qualified to do that. We are not doctors. Okay? So this is very important. And after working 2 or 3 years, you suddenly feel that you know everything about disability, and you start giving. I've seen these incidences. I have come through special educators who started, giving medicines to children with cerebral palsy and children with seizures. Please do not do it, because every medicine comes with a different formula. One medicine of seizure is not going to help with every child. Please don't do it. Another important is, don't create new labels. We already have many labels. In our country now we have 21 labels for children with disabilities. 21 labels. You can use any of those labels. But please don't create new labels. Unfortunately, there are labels which are being used which are wrong, which are not correct, which does not do justice with the child's capabilities and abilities. Those labels are demeaning. Those labels are actually disabling. So use as much less labels as possible, but explain the condition of the child in words, in sentences, rather than using a label, because we have enough labels. And our parents are sick and tired of getting these new labels, which are coming every day. There are new labels coming on in our sector. Please do not do that, because that is one thing which puts off a parent in a very big way. They get depressed. They start finding medical solutions for the label that you have given. Everybody has access to Google. They will Google it. And then they'll see 1, 2, 3 things can happen. And they will go from pillar to post to doctor to psychiatrist to another expert to medicine and several things. So please do not use new labels which are not there. Don't make new labels. Another very important thing is that never make a joke about the child in front of the parent. Even if there is a lighter moment, please don't make fun of disability of the child, because that is not something which is funny. It is not when our child, while walking, he falls off and we laugh. That gives a very huge impact. That makes a huge impact in the psyche of the child. Though the child is not able to express or probably not able to hear, but that creates a very huge impact on the parent's psyche and the psyche of the child. Please don't make fun of children with disability. Normally what you used to say, oh, this is a Down's child. A child with Down syndrome is termed as a Down's child. Now, these kind of things, and we use so many different derogatory terms for children with disabilities. Don't use it in front of parents, because they don't want to hear those things. For them, their child is as precious as our child to us. So please don't use a derogatory term or make joke about a child. And last point which I want to mention, when you are teaching parents, when you are working with parents, always make sure that you keep the child around capable and trained individuals. We should have all who are working with the parents, we need to make sure that all trained and educated and qualified people work with parents. Don't allow laymen to work with your parents, because what they do is more damage than anything else. I would suggest, if there is anyone who is not well trained, well qualified, educated, first educate your colleagues and your friends. That's how you'll be able to work with parents, create them as someone who can work with you in order to take the child out of the world of isolation to the world of inclusion. Thank you very much, Reddy Garu. Thank you very much.
Thank you, sir. Thank you very much. You are given a very valuable suggestions and new tips you can give in, sir. We are all recorded. Definitely we can use for the all the this whatever you are given for the suggestions, sir. Thank you, sir. Thank you so much for the your giving a very much time you can spend to with us. And thank you so much, sir.
My pleasure.
Now Krishna Rao garu can.
Thank you very much. You have given very good, excellent, useful tips for the professionals, sir. Those who are joined as a participants, especially communication and educate the parents, as well as never advise any medication to the children and never make fun of the child. Such kind of excellent, sir. Being a professional, I do learned a lot, sir, from you for this few words of your speech, and thank you very much being a coordinator of this CRE program. I felt very much happy with your excellent. I got a knowledge regarding with your tips, sir. Thank you very much, Akhil Pal, sir. Once again, thank you very much, sir. And Narayan Reddy, sir, please. We can have a few words for this conclusion of this thing, sir.
Good morning to everyone. Welcome to, especially good morning to Akhil sir and Lakshman sir. Thank you, sir. Welcome to all the participants. Now the participants is nearly 80 participants is there. Welcome to Aroma Educational Technical Society, Kakinada. This 3-day CRE program, all the participants are requested to participate actively, and this is the program continuing rehabilitation education. This is not a just for certification program. Most of the people of the rehabilitation professionals are the thinking like this program is the